So postnatal, once they're born, what's the disease burden? So the most important, I think, is the end-stage renal disease. Most ARPKD patients progress to end-stage renal disease. The age at onset is highly variable and appears to depend on the age at the initial presentation, which then would go back to the truncating and missense mutations. Those that with the truncating mutations will have much more severe disease. Renal calcifications are common in older children, may be related to hypercitraturia, a defect in urine, as well as a defect in urinary acidification due to renal failure. Urinary tract infections are common, up to 25 to 50% of cases, more common in girls. Hyponatremia, again, because inability to maximally dilute the urine, especially in early infancy. And the hypertension affects 80% or more of ARPKD children, important cause of mortality. It speeds up the decline in GFR, and it increases the chances of heart disease and stroke. And again, it's a renin-mediated hypertension, so you'll use medications that'll interrupt that axis. So what are the postnatal extrarenal disease burdens? So we talked about some of them, but just to go over it, growth failure is very common due to decreased kidney and lung function. Children with ARPKD are usually smaller than average size. As far as breathing problems, again, the two causes, the lungs don't develop as well as they should during the embryogenesis because of the Potter syndrome, the oligohydramnios, as well as the giant cysts pushing up into the lung space. The enlarged spleen is due to the liver disease and the increased portal hypertension. And when you see that, you have things that go along with enlarged spleen, like low red blood cell count, white blood cell, and platelet counts.